This is the Cavitron FSI Slimline 10. It is designed for removal of light to moderate calculus and deplaquing and should be used at low to medium power levels. After the clinician has filled the handpiece with water, seated the insert, selected the power, and adjusted the spray properly, instrumentation begins according to the treatment plan prescribed for the patient. The clinician will adapt either the lateral or back surface of the Cavitron FSI Slimline 10 to the clinical crown and float towards the gingival margin, maintaining 2 to 3 millimeters of adaptation and a 0 to 15 degree angulation. Depending on the patient presentation, the clinician will enter the sulcus or pocket in either a vertical or transverse approach. For demonstration purposes, we are utilizing the vertical approach for the patient with deeper periodontal pockets. As the clinician enters the sulcus, it is essential to assess the anatomy as the insert travels to the base of the pocket. If calculus is encountered, the clinician engages the terminal end of the deposit in a light tapping approach, followed by small sweeping strokes to provide lavage and assess the removal. It is imperative to ensure the complete removal by producing a stroke pattern that is overlapping and methodical. Haphazard strokes will leave the surface incomplete, contaminated, allow for biofilm to attach, and harbor the pathogens we are attempting to rid from the pocket. As the clinician moves toward the interproximal area, it is important to angulate the insert so that 2 to 3 millimeters of the terminal end is always adapted. Following the vertical orientation, the clinician will adapt in a transverse approach under the contact areas for complete debridement interproximally. Knowledge of each area of anatomy is essential for successful removal of calculus. A thorough periodontal charting and accompanying radiographs are also essential tools for effective ultrasonic instrumentation.